Mr. President, on May 29th, you'll be sworn in for your second term in office. From all of us at Nigeria Health Watch, we congratulate you on this feat. And we think that we need to remind you again that without health, we have nothing. And these are some of the recommendations we think you should focus on for your second term as President of the Federal Republic of Nigeria. The first thing we think you should do is to show more political will for universal health coverage. You've done a lot already. You've budgeted and released funds for the Basic Healthcare Provision Fund. But we think that from 2019 going forward, you need to do something drastic about universal health coverage. For example, we advise that you may want to consider removing fuel subsidy and using that money to provide universal health coverage for every Nigerian. There's no reason why in Nigeria people would be denied healthcare because of their inability to pay. So we urge you to really focus on universal health coverage for the next 4 years of your second term in office. For the second recommendation, we think you should really focus, more on health security for Nigerians. You need to budget more for health security. It is no longer a question whether an infectious disease outbreak would happen. The question now is when would it happen? And thankfully, the Nigeria Center for Disease Control and partners, they've costed the National Action Plan for Health Security. And the budget is that it will cost about 40 cents per capita, to fully budget for Nigeria to detect and respond to any outbreaks at all. And for our estimated population of about 200 million people, that's about $80 million for 1 year. So we think that you should really begin to think deeply, because if we don't do that, the estimation is that if a pandemic like Ebola happens in Nigeria at a large scale, Nigeria would lose about $9.5 billion, every year. That's about 3.5 trillion naira. And I'm sure, Mr. President, you don't want that to happen. Mr. President, at the beginning of 2019, your Labour Minister, Dr. Ngige, said that Nigeria had so many doctors that we're not exporting doctors. Mr. President, that is not true. I can assure you that so many health workers are leaving the shores of this country on a weekly basis. And our recommendation to you for your second term, the third recommendation, is that you should really focus on providing better working environment for health workers, doctors, nurses, laboratory technicians, pharmacists, community health extension workers. Because these are the people who have been trained to give up everything to save lives. So, key recommendation for us: better pay, better working conditions, better training opportunities, and better incentives, so that they will go ahead and save the lives of Nigerians.